have decided to extend the IUI camp for the month of June as well. Patients have been extremely happy and we have been able to give them good success rates, due to which we have decided to increase the time for this IUI camp. Thank you. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Today we'll try to understand if you can still get pregnant with endometriosis and how does a doctor decide how to treat you. Well, endometriosis is a very typical condition where the tissue that is supposed to grow inside the uterus is growing outside. It could be on the outer surface of the uterus, it could be in the tubes, on the ovaries or in the abdominal wall. And depending upon the severity, the area that it is covering, the depth it is covering, the bleeding that it is causing, the discomfort it's causing, the severity is decided. So they are graded according to its severity, and that's how treatment options are also given. But when a patient with endometriosis approaches a clinician, not only does she grade the endometriosis, the treatment options are then decided based on two important factors. Is it for pain management or is it for pregnancy? Is it for just pain management or is it for pain management with pregnancy? So these are very critical questions that a doctor faces. If it's for pain management, hormones are given which suppress the release of hormones which are causing the growth of this endometrial layer. So it's called hormone suppression. Basically, estrogen and progesterone, follicle stimulating hormone, luteinizing hormone, all these are important female reproductive hormones which are causing the egg to grow, the endometrial lining to grow for the next pregnancy, expected potential pregnancy, or thereby a period. Therefore, in such patients, not only does the uterine lining grow, the lining outside the uterus also starts growing in endometriosis and causes bleeding and pain. So in such cases, we also look at how to suppress the growth of this tissue which is growing outside. It is called suppression of hormones. Then this is basically for pain management, and the typical drugs given are contraceptive pills. Now, contraceptive pills will definitely control endometriosis and also bring down this pain. But you are aware that periods will also be, so to say, without ovulation. So this is what is happening in contraceptive pill pain management for endometriosis. When it is about pregnancy that we talk, well, the options are definitely not going to be treatment with contraceptive pills, because then you will stop ovulating and having periods with ovulation, and your chance of success is equivalent to 0. Therefore, the success rate priority then becomes to treat you surgically. When a laparoscopic surgical evaluation is done for such patients, endometriotic tissue is removed and then they try for pregnancy not only naturally but also with a treatment option called IVF, in vitro fertilization, where the eggs are removed from the ovaries, embryos are made and frozen, and in a subsequent cycle, when the effect of these hormones is come down, the embryos are transferred back. The success rate is very good based on the severity of endometriosis. If you have been diagnosed with endometriosis and want to understand more about this, you want your treatment options to be explained to you in detail, please feel free to contact us at Ziva Fertility. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.